Obama and the Democrat Party are in a rush to pass a national health care bill. Have you had the opportunity to read what's in the bill?
I have not. I'm not sure very many people who have.
It's bits and pieces of it, I believe, have been available, not in its entirety.
Mm-hmm.
Do you think that Americans have a right to health care, a right to free health care?
Americans have the right to the health care they can afford. And we are watching political ideologues frame the debate in such a way that somehow people are being led to believe that by having more government involvement in our healthcare system, healthcare is going to get cheaper. And there's no precedent for more government involvement in a market-based program lowering the cost of anything. One need only look at Medicare, Medicaid, Social Security, the Veterans Medical System, all of which are, people get tired of hearing how much fraud and abuse and waste and mismanagement go on. And the actuarial tables of those programs don't work. We have too few people paying in for the number of people who are in them and the amount of benefits that they receive. And so every 10 to 12 years we have to quote unquote fix the program, and the process isn't friendly or pleasant for anyone, and of course we haven't ever had a permanent fix. I think it's far better to look at market-based solutions and respect the fact that, for example, if you look at the parts of the medical industry that are not as highly regulated, that are not part of typically covered by insurance plans or part of the Medicare program, plastic surgery, LASIK eye care, the cost on those programs has come down over the years dramatically, much as we've seen the price of computers, televisions, and everything's come in. Demand creates competition, which creates innovation, which lowers price, and while at the same time maintaining a good quality of service. What we've had in the larger part of the medical community, where we have a lot of health insurance programs and some unhelpful regulation, in some cases lack of appropriate regulation, together with a government payer already in the system, has created distortions which drive the prices up for everyone. Most people don't realize, and I think you heard me mention this yesterday, there's an eye doctor here in town bills out $119 as his standard office charge visit. Medicare pays $44. It's an open question whether $44 is below cost or not. It's fairly clear that if Medicare paid market price, maybe market price wouldn't be $119 for everybody else. It's fairly clear, if you look very closely at the system, that because Medicare is basically deciding what it will pay for, rather than responding to market basis, the net effect of that is the medical community, from the doctors to the hospitals to everybody else in the system, is having to raise their prices on everybody else to indirectly subsidize the Medicare system.
To absorb that loss.
To absorb that loss that's going on. And so basically the problem is not so much the cost of medical care, is that the American people are really kind of divorced from the true cost of medicine. Everybody has, the people who have insurance will have their deduction come out of their paycheck, and it's a $20 or $15 copay to go to the doctor, and they only think in terms of the deductible when they go in for something else. And it has created an expectation for basically, I don't feel good, I need health care. And hey, it's a free country. We ought to be entitled for that to the extent we can pay for it. And I think we need to be looking at market-based solutions and try to think of ways to encourage people, to give consumers an opportunity to ask themselves if they really need this health care, and can they get this health care for less? And right now that system's not built in the system. It is command down. It's insurance companies and government programs that are demanding what's going to be paid. And it's a market that's not working. And we should fix that rather than stick more government in the middle of it.
It's an industry that doesn't have a price list. There's no such
it has
thing
a
as
price list that some of the people in the industry don't really understand.
We don't understand.
There's so many every insurance company sets its own price, and they're all doing it for the purpose of managing costs, but those costs exist. And by people capping those costs from insurance company to federal payers, you're having to ultimately dump that cost onto somewhere else. We've also heard the stories about the $400 hammer or the $800 toilet seat. Obviously, the reason those things were billed out that rate is because there was something else that had some cost in it that they didn't get reimbursed for, and it had to be allocated elsewhere. And that is going on in our health system, and people, I don't think, fully realize that. And I don't think they also realize that, at essence, what the Obama administration is proposing is to save money by spending less on health care. The only way you can spend less on health care is to use less health care. And a lot of people would be uncomfortable with that because we like our health care. But if we're going to look at ourselves in the mirror and say, well, we need to use less health care so we can spend less on health care, I would much rather see families make that decision rather than have government officials make that decision. Because make no mistake, if we go to a single payer system where the government is rationing health care, you will see things like people over the age of 69 are not going to be allowed to have kidney dialysis. We already see that in Europe. In some countries in Europe, when it was the universal health care came out, the age was in the low 70s. You could qualify for a dialysis, and now in some of those countries it's in the 50s. How would you like to be 61 years old, otherwise in good health, have the money to pay for the dialysis or the insurance policy to support it, and be told that you can't have it because there's not enough machines to go around and younger people need it? I don't think America's really looking at the kind of choices that are going to be forced on them in a command system from a basically government regulation standpoint.
Do you care to reflect on what you think may be, this is a bigger picture, the current administration's desire to pass this health care bill so quickly, and what, beyond that, what it actually entails, the one less freedom that we'll have?
It's absolutely preposterous. That is messed up as our system. Doctors have pricing structures which they don't fully understand because they're not rational. That you can have a group of people in Washington in 3 weeks can whip up a fix. It's just preposterous. It takes much more time than that. This is a situation that was decades in the making, and if we were really serious about fixing it, we would be looking at months or years devising the appropriate systems, and we would be taking the recommendations from colleges of medicine. Every professional practice has a college of medicine that sets forth standards of care. I haven't heard anybody in Washington talking about interviewing physicians or their leaders in their colleges about how to fix this problem. I mean, maybe going on behind the scene, but I think what you really are looking is you have some politicians who want to put government in the middle of this first. Whether they fix it or not is secondary, because they figure they can always play politics with it further on down the road. And I just don't think we're going to improve anybody's health care by making it more political than it already is.